Oh, no. Sunglasses to the right, postcards to the left.
Sunglasses right, postcards left.
You're a good boy, aren't you?
He'll catch it if the doc sees him in here.
Doesn't seem to be himself.
Tell you that, did he?
Perhaps he's not getting enough exercise. Is that what's making you sad, That grumpy old doc not taking you out for enough walks?
Yes?
I've just come off the phone from Dr. Ryder.
Oh, has she had our test results yet?
She says your sperm count isn't an issue, and I have good ovarian reserve. Now, there's a sentence I never thought I'd find myself saying.
Did she say anything else?
Well, the test results show that I haven't ovulated again, and she wants me to take something called clomiphene.
Yes. Oh, that's less invasive than IVF. I'd have prescribed that.
Well, that's good, because she's going on holiday, and she's asked if you could write the prescription.
Of course. Oh.
It's backing up out here, Doc.
No. Get out! Get out!
No, don't shout at him, Morton. He's been a bit off colour all morning, hasn't touched his breakfast.
Poor buddy. No wonder he feels neglected.
Yes, take a seat, please. First patient. Come through.
I found a lump in my right breast.
Is it tender?
Yeah, a bit. It's more of an ache. My lymph nodes are swollen as well.
When did you first notice this?
A couple of days ago. I've been worried sick ever since.
Right. I need to examine you. Take off your blouse and your bra and lie on the table. You can cover yourself with that. Is there any history of breast cancer in your family?
My aunt on my mother's side, my father, Dr. Sim, he died of lung cancer, as you know.
When was your last mammogram?
2 years ago. I'm due another one next year.
Right.
Oh. You really should pay Buddy more attention, you know. Dogs can suffer from anxiety and depression just like humans.
Breast cancer lumps tend to be firm. When they're tender like this, it's more often some sort of inflammatory cyst.
It doesn't explain my lymph nodes.
Lift up your arms. Yes, they're inflamed. I'll do an ultrasound.
Well, that's the last of it. I always thought it'd be emotional, watching my son leave home for good. Obviously, I thought it might have happened a decade or so sooner.
It's very funny, Dad.
I just hope, in the nicest possible way, you don't ever want to come back.
Me too.
Come on. Okay. Yeah.
Still see him every day. He works here. Looks like it's just the two of us.
I've just left something behind the bar.
I'm right behind you.
Yeah. See the area of inflammation?
It's not a tumour.
No, it's traumatic fat necrosis.
Should I know what that is?
You're a vet?
Yes, I'm a vet. I'm not a doctor.
It's a benign lump, often mistaken for breast cancer.
Sure.
Yes.
Oh, my God.
The cause when an area of fatty breast tissue becomes damaged by an impact.
Well, I'm often knocked about a bit. It's a hazard of the job.
In most cases, the lumps go away on their own, but yours has developed an oily cyst within the damaged tissue, and that'll have to be aspirated.
That sounds uncomfortable.
Yes, it is. I'll give you a local anaesthetic.
And afterwards?
Nothing. No medication is necessary. It's unlikely that the lump will reoccur, unless you get hit in the breast by another animal.
It doesn't explain my lymph nodes.
It's probably just an inflammatory reaction to the cyst. Come back in a week. If they're still inflamed, then I'll run some tests. Hold still.
That Bethany girl's here to see you.
Really?
Yeah.
Bethany, we don't have an appointment, do we?
No, but I wanted to see you.
Well, unfortunately, it doesn't work that way. You'd need to schedule an appointment with Professor Bradman.
But last time you told me if I ever felt anxious, I should talk to someone about it.
Yes, well, last time it was an official counselling session. You know I'm not qualified to talk to you alone.
But I don't have anyone else.
What about your grandmother?
She's still mad at me for burning down her shed.
Yes, well, that's understandable. What about your parents?
Mum's moved out, so I've only got Dad, and he's working away.
And don't you have any friends that you can talk to?
None of them are speaking to me at the moment. Please, I only want 5 minutes. You really helped me last time.
Well, I suppose we could have a quick chat. 5 minutes over a cup of tea. But just this once, okay? Yeah, come this way.
Dr. Ellingham, I am glad I caught you. This is Sarah, my cousin's daughter.
Pleased to meet you, Dr. Ellingham.
Yes?
Sally's told me all about you.
Oh, I bet she has.
I'm looking forward to working alongside you.
What do you mean?
Oh, Sarah's doing a pharmacy degree. She's shadowing me for a few weeks as part of her summer placement. Just wanted to let you know.
Yes?
How many other GPs work here?
None?
That's unusual. Must be very overstretched.
Oh, no, Dr. Ellingham is more than enough.
Albert Ross,
About time.
come through.
Yes. Like I said, he's a very busy man.
So you said something about your friends not speaking to you.
Thank you. It was all Kelly Patterson's fault. She blocked me, and then everyone else followed.
And why do you think that is?
I didn't say anything bad, if that's what you think.
Have you ever thought about rising above it, being the bigger person?
What do you mean?
Or do you think if you had a chat to Kelly, she might tell you what's wrong?
Well, I can't speak to her, can I? She's blocked me.
Well, you can speak to her in person. Face to face, not on the phone.
Oh. Yeah. That might actually work.
I didn't realise the shop had been in the family so long.
Oh, yes. Your great-aunt Virginia started it. Must be over 100 years ago now. And then when she retired, my grandmother, Ida, inherited it. And then she passed it on to my mother, Dorothy. And then she handed it on to me.
So what happens when you retire?
Well, I was waiting to see how your work experience went. But since you asked, one day, when I retire, I'd like you to take it over.
Me?
Well, it's family business. It ought to stay in the family.
Oh, I don't know what to say. Thank you.
No.
Of course, the place will need some modernising.
Huh?
A computer system, for starters.
Oh, no. I don't go in for all that computer nonsense.
Imagine how much simpler it would be if Dr. Ellingham emailed you the prescriptions rather than writing them out by hand.
Oh, no, I prefer a much more kind of face-to-face service.
According to my tutor, computerised prescriptions cut down on medication errors by as much as 60%. And besides, it'll make it much easier to keep an eye on Dr. Ellingham's prescription regime.
Why would I do that?
Because pharmacists are the first line of defence against overstretched, prescription-happy GPs.
Oh, no. Not Dr. Ellingham. Dr. Ellingham's a marvellous doctor.
The overprescription of antibiotics by GPs is contributing to a dangerous rise of antibiotic-resistant bacteria. As pharmacists, we have to be vigilant.
Oh, I don't know what they're teaching you at this university. It's not our place to question Dr. Ellingham's authority. If he says a patient needs medication, we dispense it. End of discussion.
But that's the old way.
As I said, end of discussion. You can help yourself to vegetables. If you want them.
You're so easy to talk to, Louisa. Wish my mum was like you.
Do you have much contact with her?
Not much. She sent me a card last month for my birthday. No money in it, though.
Well, it's the thought that matters, though.
It was 5 days late.
Better late than never.
Is it though? I feel like she even regrets having me.
No, I'm sure that's not true. Why don't I see about getting you some extra counselling sessions?
That'd be great, yeah. I'm happy to just do it like this, though. Sit in here talking to you.
No, it's better that we do it properly.
So am I interrupting something?
No.
It's okay, I'm just leaving. Thank you, Louisa.
See you at our next session.
See you soon.
Bye.
Isn't that the girl you saw with Professor Bradley?
Bethany, yeah.
I thought your sessions were supposed to be supervised.
Yeah, but she turned up unexpectedly.
So you told her how appointments work, did you?
Well, she was upset. I could hardly turn her away, Martin.
Not something you want to encourage, though, is it?
It's resolved now. Won't happen again.
Yes.
Well, we're very busy, so...
Ruth?
Martin, have you got a moment?
Well, I've got patience, but I can squeeze you in, yes.
I've been doing some research on behaviour therapy for my new book, and I came across this paper on in vivo exposure therapy.
Flooding?
Oh, you know about it?
Not much. It's a sort of exposure therapy, isn't it? Used in the treatment of anxiety disorders. Oh, for God's sake, you didn't just come across this, did you?
No, right. All right, I didn't. But it's a well-known way of treating phobias, such as blood phobias.
Well done. Very subtle.
There's no time to be subtle, Martin. You have your final assessment with the GMC coming up. Assisted surgery. There will be blood. Thick, red, flowing blood.
And I will deal with it. I also have a waiting room full of patients, if you don't mind.
Read the paper, Martin. Call me if you change your mind.
Rise and shine, my little sleepyhead.
What? What's going on?
You can't lie in bed all morning. Lots to be getting on with.
Well, what time is it?
Time we got profits up. I've made you a job list. You can start by doing a full stock take.
How did you get in?
You're forgetting. I own the place.
Have you seen James's shoes?
Yes, I polished them. They're on the chair.
Oh, thank you. Oh, dear. But he's really not himself today. Normally he'd be dashing about all over the place.
Poor buddy.
Can you take a look at him?
I'm not a vet, Louisa.
No, but you can probably tell if something's wrong with him. Sweetie, pop your shoe foot in there.
Well, he seems fine to me. It's hard to tell. He's covered in fur. As I said, I'm not a vet.
Yeah. I'll keep an eye on him anyway. Come on, James. Are you still okay to collect James from nursery tomorrow? Because I've got college all day and I might not be back in time.
No, I can't do tomorrow. I've got an extended surgery. I'll ask Ruth if she can do it.
Thank you, Martin. Come on. See you later.
So lunch?
There we are.
Are you sure you've sent out the wedding invitations?
Do we have to do this now, Joe?
It's my duty as best man. So, invites, RSVPs?
Sent and received. Moena's parents are flying in from Kenya.
Suit?
Got it.
Wedding dress?
Yeah, Moena's got a vintage one from the 60s, apparently.
Speeches?
Told you, Joe. No speeches.
No speeches, yes. But what sort of a wedding is it going to be? Bonfire on the beach? No stag do? No sit-down meal? Vintage dresses? I wasn't going to say anything, but I'm really worried.
Well, your concern is both noted and ignored. Although, I do need to know if you're bringing anyone as your +1.
Yes, in an ideal world, but I haven't got anyone to bring, so...
Why don't you invite Tessa, the one from the fish shop?
Because she's always talking about fish. Mackerel this, mackerel that.
What about her sister?
Opposite problem.
She never talks about fish?
Never says anything. What if I can't find anyone to bring?
Maybe you'll get lucky on the day. You're a single best man at a wedding. You're bound to pick someone up.
Shh. Around a bonfire.
Good. Oh, yes, very. Oh, now that would be the suppliers for our old...
Can I get a prescription, please, Mrs. Tisha? Oh, hello, you're new.
I'm Sally's cousin from Bristol. I'm helping out for a few weeks.
Oh, I see.
Sally's on a call. Do you want to come back or would you like it now?
Oh, now I'm in a bit of a hurry, if that's okay.
No problem. Louisa.
Bethany, what are you doing here?
I've been looking for you everywhere. I wanted to talk to you.
This isn't the right time, Bethany.
See, I did what you said, but it didn't work.
But we really can't discuss this here.
But you said I could talk to you any time.
Well, I didn't quite say that, did I? Maybe we should step outside. Bethany, what's going on?
So, I apologised to Kelly, like you said, and told her it was all a big misunderstanding, and we were all mates again. But then this morning, I saw that she posted a horrible photo of me.
Bethany, I'm really sorry to hear that, but this isn't the right place to talk.
But we could just go to your house like before.
No, that wouldn't be appropriate. Why don't I see if we can bring our next session forward to early next week?
But that's ages away.
I'm sorry, but it's the best I can do, and we shouldn't even be talking like this. So you should go home, and Professor Bradman will be in touch, all right?
Your prescription's ready.
Oh, thank you. See you next week.
There you go.
Oh, thank you. See you next time.
Fell down on a rusty nail in the garden. Oh, I've got it here with me if you want to see it.
No, put it away.
Right.
When did you last have a tetanus injection?
Can't rightly remember.
I'll give you one in a minute. You know, it's a good idea to keep a record of these things.
Well, thank you for your advice, Doc. And in exchange, I'd like to offer you some of my own.
What do you mean?
Well, little bird told me that you and Louisa have been having a bit of trouble in the old baby-making department.
Who told you that?
Well, 'tis all over the village. No, I'm no doctor.
No, I didn't think you were.
But I've had 5 children of my own, and every time I wanted to fall pregnant, I used to have a good old slug of cough medicine before me and my husband. You know, worked every time.
Using cough medicine to try and conceive is an old wives' tale. Has no basis in medicine.
Worked for us.
No, it didn't.
All right.
I got you. Keep coming, there's plenty of room. Bit more.
I'm quite capable of parking on my own, thanks, Joe.
Keep coming. Janice?
Oh,
Thought you said you knew how to park.
you were the one waving me on. Is there any damage?
Can you see any damage?
Nope.
Well, then there's no damage.
And £2.20 change.
Well done, Sarah.
Not my usual antihistamine, please, Sally.
Righto.
God, hay fever's playing havoc with my eyes.
Is your hay fever worse than normal?
Must be the pollen.
You may have been on the same medication for too long. Would you like a private consultation to discuss an alternative treatment plan?
No, that's not how we do things around here. So, no, definitely not. Dr. Ellingham's the only person able to offer treatment plans. Here you go, Angela. You'll have to forgive her. She's still in training.
No, that's all right. I like the idea of an alternative treatment plan. It's worth discussing.
Not an option.
Well, I'm here for the next 2 weeks.
On probation is your change.
I'll be back.
No, you'll have to check with Dr. Ellingham before you change your medication, Angela.
When?
All right, Joe.
Going somewhere?
Yeah?
Meeting someone for a drink?
No, I promised Al I'd give him a hand.
So you're not meeting anyone in particular? Like an old friend?
Why are you being weird?
Look, if it's Janice, it's fine. You don't have to worry about me.
Janice? No, I've not heard from her for ages. I mean, I messaged her about the wedding, but she never got back to me. Why?
Could have sworn I saw her earlier.
You're imagining things, Joe.
Yeah, must be.
Have you ever had a patient that's tricky to deal with?
Yes, most of them.
Yeah, I probably worded that wrong. I meant more in the way that they responded to you.
I'm not overly concerned how they respond to me. What do you mean precisely?
Well, it's just that I think that Bethany started wearing a hair like mine. She's even had a fringe cut to match.
Oh, good God. Professor, what's his name? Should have known that a girl like that's not suitable for a beginner.
Well, in Sam's defence, I was the one who agreed to see her on her own, so... Did you hear that? He did it again. Do you hear him?
Yeah.
Let's go and see him.
go. It's all right, sweetie. It's all right. There.
Oh, buddy. Anyway, I've made it clear that I'll only see her on her own in future.
You should have been firm with her in the first place.
Yes, I'm aware of that. Thank you.
One of the reasons why I refuse to engage in idle chit-chat with the patients.
Well, you don't engage in idle chit-chat with anyone, Martin.
Thank you.
On you go.
I'm changing those barrels.
No, you and Moana go home. I'll do it.
Don't take too long. There's lots of glasses to clear up here.
I'll see you tomorrow for the delivery.
Night, boy. Night, Moana.
Night.
You still down here?
I'm working as fast as I can. Rome wasn't built in a day, girl.
You're just changing a barrel, Bert. There's loads to do upstairs.
Keep your hair on.
Oh, Bert. Look.
I've been meaning to fix that. Don't worry. I'll ring Al, ask him to come back.
Go on then.
Just one thing. My phone is behind the bar.
Oh, so's mine. Oh.
Don't worry. I'll look for some tools.
Oh.
Oh, he's driving me mad. All his checklists. It's like it's his big day off. Did you leave the door open?
No. The light's on.
There's someone there.
Oh.
What are you doing?
Phone in, Joe.
Don't be ridiculous. Just go in.
You go in. Oh. Oh.
Janice! Got your message. Thought you might need a maid of honor.
When did you get here?
This morning. Been waiting around all day.
How did you get in?
Still got my spare key.
Ah.
Where have you been?
Where haven't I been? Travelled all over after me and Joe broke up.
Does he know you're back?
No, I thought I'd burn that bridge when I came to it. I'm sure it'll be fine.
So what have you been up to?
I got this amazing job in a bar in Hispania.
Hispania?
That's what the locals call Spain. And I stayed on because I loved it so much. Started doing people's nails.
And now you're back.
Couldn't miss my bestie getting hitched, could I?
Well, you know the wedding's not for a couple of weeks.
Figured you want a hand.
Well, you should have called ahead first. Let us know you're coming.
And spoil the surprise.
Where are you staying?
That's the other surprise. I wondered if I could maybe stay with you. I won't be a bother, promise.
Of course. I'll go make up a spare room.
So, I've got my dress.
I've got some good news and I've got some bad news.
What's the good news?
Actually, I don't know why I said that. It's all bad. No, there's no way we're going to get out through that door.
I can't stay locked in here, Bert. Not all night.
Well, I'm not exactly thrilled by the idea myself.
You don't understand. I don't like confined spaces.
I know. Steady now. Look, there's nothing to worry about. That's it.
I was a terrible sleepwalker when I was young. My mother used to lock me in my room to stop me getting out.
All right, no. Just take the weight off. There it is. Take the weight off. Now, a few deep breaths. Let's do them together. Now. That's good now. I'm going to take a look at the door. Sure we can find a way out.
Oh, sorry.
No, it's fine. There's plenty of room. Come on.
Okay. What's that?
It's what Dr. Ryder prescribed.
Clonidine? That's a blood pressure medication. You haven't taken any, have you?
No, but I was going to.
Well, don't.
She must have had the prescription wrong.
Who, Mrs. Tishel?
No, the new girl, Mrs. Tishel, wasn't there.
The new girl? She's still at university. She shouldn't be dispensing anything.
Well, it's probably an easy mistake to make.
Mistakes like that get people killed. I'll talk to Mrs. Tishel in the morning.
It's a good job I didn't take any.
Yes, it is.
It's no good. We're going to be stuck in here until Al comes tomorrow morning.
I won't last the night down here. I got stuck in a lift in Blackpool. They had to drag me out, screaming and crying, and that was only 10 minutes.
Here, take a swig of this, right? It'll settle your nerves. Now, go on. Trust me on it.
Oh.
What are you doing?
I just heard him whimpering. I'm really worried about him.
Take him to the vets in the morning.
No, I think he should sleep in our room with us tonight.
Oh, no. That's unhygienic.
Well, in that case, I'll stay out with him a while longer then.
All right. Wash your hands before you come to bed.
Yes, Martin.
Here, are you feeling any better now?
A little better. I know this must be your worst nightmare, being stuck in here with me.
No, of course not.
I never imagined I'd end up locked in the cellar with you either.
You should have spoke to Ruth. Something like this was bound to happen. You, Caitlin Morgan, have gone into business with a Jonah.
Oh, stop feeling sorry for yourself.
It's true. I'm a walking disaster. Everybody thinks it. When people in the village see me, they see a joke.
You know what I see?
Yeah. A man who keeps putting off fixing the basement door.
Yes. But I also see a man who's raised his son single-handed, made sacrifices, worked hard his whole life. Mostly. There aren't many like you, Bert. And that Bert Large is what I see.
That's the nicest thing anybody said to me in a very long time.
Louisa? Louisa? Have you spent the whole night here with the dog?
Well, no, not intentionally. He just seemed so listless. I didn't want to leave him.
Do you think he's got worse?
His stomach feels all hot now.
Yeah, all right. I'll get dressed and take him to Angela Sims.
Boy, that's it. Make it better. There. Is he all right?
Right, I'll call you.
Dad?
Miss Sim?
Hello? Oh, Dad.
Stop, Caitlin. Now, is that you?
Have you been here all night?
It's not what it looks like.
Well, nothing happened. Nothing happened that I can remember, anyway.
Well, you're both grown-ups. You don't have to explain yourselves to me.
You don't understand. We got locked in by mistake. Bert, tell him.
Caitlin's right. The door handle, it fell off again.
You said you'd fix that.
No, this isn't funny, boy.
It is a bit, Dad.
Al's right. It is a bit.
I'll put the kettle on.
Hurry up! Open the door! Come on!
Doc, is that you?
Yes!
I've been calling the surgery, but no answer.
Well, it's too early. It's not open yet. What's wrong with your eyes?
I can hardly see. I've rinsed them twice, but they're no better.
Wait, hold this. I'll get my bag out of the car.
Buddy? eyes were blurry yesterday, but now I can't focus on anything. Oh,
Careful.
what is wrong with me?
Come here. Look straight ahead.
Why is he whimpering?
Look straight ahead. Yes, you have acute retinopathy. The retinal vessels are swelling and that's weakening your eyesight. What are those marks on your hand?
Oh, they're scratches from a stray that I'm rehoming for Mrs. Kemp.
Lift up your chin.
Oh, what are his symptoms?
He's listless, his breathing is laboured, and his abdomen is tender and hot to the touch. Your lymph nodes are still inflamed. I don't think it's anything to do with the cyst. I'm going to take some blood and test you for cat scratch fever.
Oh.
I take it you're aware what cat scratch fever is?
Yes, yes. You get it from cats infected with Bartonella bacteria.
Good. Then you'll also be aware that if left untreated, it can lead to temporary blindness and neurological complications.
It could be peritonitis.
In your eye?
What? No, no. Buddy, help me check his abdomen.
Oh, I haven't finished with you.
Cat scratch fever is fully treatable with antibiotics, yes?
Yes?
Yes, so Buddy takes priority. You'll need to take a rectal temperature.
No, I'm not a vet.
I can't see.
Well, I'm not using my thermometer.
Oh, there'll be one on the trolley there somewhere.
Oh.
How long has he been like this?
A few days.
A few days? Why didn't you get him to me sooner?
I presumed that whatever it was would pass. It's a dog.
Oh, Buddy. Heaven preserve us from humans and their presumptions. What's his temperature?
106.
Oh, that is not good.
What are you feeling for?
Some sort of wound caused by a stick or something. Oh, I'm so sorry. Sorry, Buddy. Sorry. Yeah. There it is. What can you see?
Yes. There's a small puncture mark just below the rib cage.
Yeah, that'll be the cause of the infection.
What are you doing?
You'll need to shave his abdomen before you operate. I'll talk you through it.
What? Don't be ridiculous. We'll just take him to another vet.
Well, the nearest vet is 40 minutes away. Buddy hasn't got that long.
I can't operate on a dog.
Then Buddy will die, and you will have to tell Louise and your son that you just stood there and let it happen.
It's Louisa. Made the midline incision. I'm just trying to find the muscle.
Right. You will need the rat tooth forceps.
What's wrong with the tissue forceps?
No, these would be better for tenting the muscle. Less likely to drop it. So we need to make a shallow stab incision. We want to avoid the spleen. Right, now we need... Right.
Ow!
Sorry. Right. So extend the incision cranially and caudally. Can you see the spleen?
Yes.
Right. Move the spleen gently to one side. Right, you're going to need swabs. Swabs to... Yeah. Fluids.
Yep. I can see the object that's caused the injury. Good dog.
Right, just check there's nothing loose in there before you examine the intestines, then you can flush it and suture the wound.
Janice? Oh, sorry. Mistaken identity. Never mind.
Joe, it's me.
Yes. It's definitely you. I thought I saw you the other day.
I should have come and said hello straight away.
You're back then?
Morena's maid of honor.
Oh, I wasn't informed. I'm Al's best man.
Yeah, I know. A little bit awkward.
You look tanned.
Spain.
How was our honeymoon?
The hotel looked better in the photos.
It's annoying when that happens.
They did have his and hers bathrobes, though.
So, is this just a visit?
Maybe more. Thinking of opening a nail bar.
Sounds like we'll be seeing more of each other then.
Yeah, as friends.
Of course, I'm totally over you.
Good, I'm totally over you too.
I was over you first.
It's not a competition.
No, but if it was, I'd have won.
I'll give you that then. See you around, Joe.
Not if I see you first, or second, or... Shut up.
I'm going to give him antibiotics and painkillers.
You need to go to a hospital and see an eye specialist as soon as possible.
He's got to keep that collar on until the wound heals.
Yes. I'll give you a precautionary injection of antibiotics.
Ah. Oh.
How are you going to get to the hospital?
Oh, I've got a girl who works for me. She'll be here soon.
Right. Well, I'll wait with you.
No, we've got surgery.
All right, well, I'll be in touch with the hospital. Please make sure you go.
Of course I will. Do you think I want to go blind?
Oh, Dr. Ellen, how can I help?
Well, you can start by supervising your staff properly. The girl issued my wife with a course of clonidine when the prescription clearly stated clomiphene.
I don't remember Louisa coming in for a prescription.
You were on the phone. I thought it'd be okay.
Well, it clearly isn't. Oh, I'm so sorry, Dr. Ellingham. This is unforgivable.
I'm sorry. It was one mistake.
Is Louisa all right?
She's fine, thank you, but it could have been worse.
This just proves my point. If this place was computerized, I wouldn't have misread your handwriting.
My handwriting is perfectly legible, thank you, and that is not the point. How many other prescriptions have you issued?
That was the only one.
I cannot apologise enough, Dr. Ellingham. I really cannot. I promise you, this will never happen again.
Well, make sure it doesn't. She could have killed someone.
Look, let me sort Louisa's prescription out for you.
No, I haven't got time now. I'll get it later.
Oh, no. Oh, no. I'll bring it up to the surgery, Dr. Ellingham. It's the least I can do. Oh. Stupid girl.
Well done.
Sarah, what are you doing?
I'm leaving.
Well, that's a very emotional reaction to a work situation.
I could have done some real damage there. And my dad. Well, I can hear him now. You're just not cut out for this, Sarah.
Come on now, we all make mistakes.
So it's happened to you before?
No, of course not. You've got a very bright future ahead of you as a pharmacist. You just need to learn a little humility and that some people know better than you.
Like Dr. Ellingham.
Exactly.
So do you still think I can take over the pharmacy one day?
Oh, no, you'll never work in this village again. I'll call you a taxi.
Louisa. What are you doing in my kitchen?
Foot.
What?
My foot.
Oh, God. Don't touch it. You might have severed an artery.
Oh. Bloody hell. Doc?
Just brought round your prescription, Louisa. I would... You're not Louisa.
It's not what it looks like.
Dr. Ellingham! Give me that knife. What? Yes. Give it to me. Oh, don't worry, Dr. Ellingham. I will protect you.
Oh, you're on me.
What is going on? Martin. I apprehended the suspect, Louisa. I found her attacking the doctor with a knife.
I was just cooking dinner to say thank you for being so nice.
Mrs. Tishel,
What?
just give me the knife.
What?
Give me the knife.
Oh, yes.
Thank you.
Then I dropped the knife on my foot and he fainted.
Okay, yes, there is a lot of blood. Bethany, come sit down.
Go on, sit down.
Martin.
Elevate the wound and apply a clean compress.
I just came round to deliver your prescription, Louisa. Here it is on the table. And I hope it works for you.
Bye.
You know, you're very lucky you didn't lose more blood.
When you think about it, I wouldn't have dropped that knife if you hadn't startled me.
When you think about it, you were in my kitchen, uninvited, dressed up as my wife.
Well, when you put it like that.
You understand that what you did was totally inappropriate, Bethany, and that I will have to report this incident to Professor Bradman. You know, if the last few days has taught us anything, it's that you need a lot more support than either of us anticipated.
I was just trying to say thank you.
Anyone at home?
Yes, in here, Ruth.
James Henry's in his room playing with his bricks.
Oh, thank you. Thanks, Ruth.
Is everything okay?
Yeah, it's fine.
Is this your sister?
Oh, I don't have a sister.
She's an only child.
It's complicated.
Oh, I'll speak to you later, Martin.
Yes.
Actually, Ruth, can I have a word? I'm going to call your grandmother and tell her to pick you up.
You fainted.
Ask your own GP to take these stitches out in 7 to 10 days.
It's classic mirroring. Do you blame yourself for the girl's behaviour?
Yeah, a little.
That's why practice training is supervised. Then any mistakes can be made in the right environment.
Yeah, that's true. But I'm afraid there's something else.
Martin?
He fainted when Bethany dropped the knife on her foot.
That's twice now.
With the final GMC assessment coming up too.
What do you suggest? An intervention?
Do you think it could help?
It might. Leave it with me. I have an idea.
Thanks, Ruth. Oh, don't tell him I said anything.
They're sending Bernard Newton.
Are they?
Martin.
So we don't need to worry anymore?
I wasn't worried.
I'm sorry you don't feel like you'll be centre of attention on our wedding day.
Well, it's not all about you.
I'm not entirely sure there's going to be a wedding.
You have taken steps, haven't you?
He's put a lot of effort into bringing it under control.
You okay?
Martin?
And the doc is back at the same time next week for the final episode in the series. We have a brand new documentary here on ITV to celebrate Prince Charles's 50 years as the Prince of Wales. 50 Years a Prince is tomorrow night at 9. And we've also been celebrating the amazing career of that gardening legend. 50 Shades of Green with Alan Titchmarsh is on ITV Hub. The ITV News is on the way next.